Leukemia. Warning symptoms.
There are many symptoms that patients present with when they have a leukemia. The general symptoms that patients tend to have is, number one, they tend to develop fever, persistent fever, at least for more than a week, and they have visited many clinics, have taken antibiotics, medications, and yet the fever still persists. Number two is they tend to have recurrent infections. Despite having been treated well, they tend to still come back with infections. The third is when patients have got unexplained weight loss and loss of appetite. The other symptoms that patients can come with is due to bleeding. So this category of patients tend to bleed easily. For example, they tend to have gum bleeding, or bleeding from the nose, which is called epistaxis. Or they can also have bruises, unexplained bruises, meaning they have not had any trauma, but they tend to develop bruises very easily. Another group of symptoms that patients tend to have is persistent bone and joint pains. That's one. And number two is they have swollen lymph nodes, especially seen in patients with chronic lymphocytic leukemia. So patients tend to have generalized swollen lymph nodes as well. And especially in chronic myeloid leukemia, patients can develop hepatosplenomegaly. That means basically both the liver and spleen are enlarged. And what happens when someone has got enlarged liver and spleen? They tend to feel very bloated. Even eating a little bit of food, they tend to feel very full. These are a couple of common presentations this group of patients tend to have. But what is a red flag for someone who's got acute leukemia is, number one, feeling generally very unwell for more than a week despite on treatment. Number two, having tendency of bleeding, unexplained bleeding. These are telltale signs that patients need to come to the hospital quickly to get themselves checked, to diagnose early and start treatment.